Hello, are you ready for your trauma assessment practical exam? Yes, I am. This is my second time through this class. I passed this last time, so there's no way I can fail again. Okay, would you like to inspect your equipment? No, thank you. I should have everything I need already. Okay, whenever you want to start then. Okay, I am ready now. You have responded to a motorcycle accident. You see one male patient lying in a supine position on the ground next to his motorcycle. He is not moving and you see minor facial bleeding. BSI, scene safety. Is the scene safe? Yes, it is. Is this my only patient? Yes, you have only one patient. Okay, I am going to have my invisible assistant hold C-spine. Okay, C-spine is held. I am now going to verbalize my general impression and mechanism of injury, also called for a LS backup. It looks like I have a dumbass male patient in his early 20s laying supine on the side of the road. He appears to be breathing. His mechanism of injury is obviously a motorcycle accident. I am now going to assess his responsiveness. Hello sir. Can you hear me? I am an EMT here to help you. Do I have any kind of responsiveness to verbal stimuli or painful stimuli? Yes, he responds when you rub his sternum. Okay, I am now going to open the airway using the jaw thrust maneuver. I am going to visualize the airway looking for any blockage. I am also going to look, listen, and feel for breathing. Is the patient breathing? Yes. What is the rate, depth and quality? His rate is 12, shallow and labored. Okay, what do you mean, shallow? You fucking moron. The patient has a reduced tidal volume. Oh. I am now going to insert an oral airway and apply oxygen at a rate of 15 liters per minute using a non-rebreathing mask. The patient gags when you insert the oral airway. Okay, I am going to remove it and try to force it back in. You do that. I am now going to assess the patient's circulation. What is the patient's pulse, quality and skin color? The pulse is 40 beats per minute, and tachycardic, and his skin is pale, cool, and clammy. Sweet. I am going to control any obvious bleeding. Do I see any major signs of bleeding, you prick? Excuse me? Do I see any major signs of bleeding? Yes. And where would that be? He has minor bleeding to his face, you little fucking cocksucker. Okay, I am going to apply a large bulky dressing to his face with firm pressure. Does the bleeding stop? Yes, and so does his breathing. I don't know what to do now. You are fucking retarded. Just keep going with your assessment. Okay, I am now going to make my transport decision. And what would it be? I am going to rapidly transport. Good choice, Sparky. My name is Matt, and I would appreciate it if you would not call me Sparky. Fine, I am now going to perform a rapid scan from head to toe. Okay, Matt, I am going to start with the scalp, looking for any deformities, contusions, abrasions, penetration, burns, tenderness, lacerations, and swelling. Wow, I am surprised you actually remembered that, Sparky. I am going to assess the face, ears, looking for any CSF or drainage. I am going to assess the nose and palpate the cervical spine. You feel step off. I assume that is not good. No, it is not. I am going to check for JVD and check for brachial deviation and apply a collar. You see brachial deviation. I don't know what that means. Jesus fucking Christ. Did you read the book at all during your 2 failed semesters taking this course? No, I thought that is what the PowerPoint was for. Well, I use it would have helped you if you weren't too busy playing Brick Breaker, instead of paying attention. I figured that since I just failed my last final, I didn't need to pay attention because I already pretty much passed the class already, and because the lead instructor was such a prick, and gave me the hardest test, I failed. So, I just need another shot at the final written exam. Whoever passed you the last time you took this practical should be fucking shot with an arrow through the right lung, and left for you to treat them. I forgot to have my partner obtain a set of baseline vital signs and a sample history from any family or friends that might be on scene. Just get the fuck out of here, you fucking prick. What is the patient's blood pressure? Fine, the patient's blood pressure is 0. That's not good at all. Not it's not, and neither are you. I want to talk to the head instructor. You obviously failed me because you are a fucking shell, and don't like me for some strange reason. You little fucking sheepbag, I didn't fail you, you failed yourself. You are obviously too stupid to be an EMT, you should find another job as a fucking retarded greeter at Walmart. I think that would be the only thing you could handle. Go fuck yourself. Now you need to get the fuck out of here and go cry to your daddy who paid for your failed attempt at becoming an EMT, twice. I am going to wear your skin. Maybe you will if you can even figure out what part of the body that is. Now get out before I make you suck my cock like the bitch you are. I am not going to assess the chest for equal rise and fall. I might even listen to lung sounds while I am banging your wife from the back. I will then blow my load into her sloppy vagina. The scene will then no longer be safe and I will go back to my ambulance. Goodbye, and go fuck yourself.